In this next video, we are going to cover the upper part of the arm. So you can see I am on the upper limb here. You can actually see where we've previously cut that clavodeltoid back so that you can see the acromiodeltoid here. Now what we're going to do is kind of move down a little bit from the shoulder and work on the back of the arm here. So the back part of the arm is going to have your triceps. Triceps are called triceps because they have 3 origins. Now in the cat, you're going to be able to see each of these different origins making out different muscles. We refer to them as the medial, lateral, and long heads of the triceps brachii. So here you can automatically see 2 of those heads of the triceps. Now this one already actually has an incision here. If you cannot see where yours is located, you want to clean some of this connective tissue off the surface, and then you can usually feel around with your hands and your fingers. You can usually kind of get it in there to feel where the separation is, and then once you start with a little incision, you should be able to open that up pretty nicely. Now these 2 here, this one is the lateral head of the triceps. Think of it as being the most laterally located. This one is called the long head, and you can think of this as the flap under your arm. I like to lovingly refer to it as the bingo granny flap. That is the long head. Some people refer to it as like the bat wing, right? That flab of skin that hangs down on the triceps there. And then once you open these so that you can peer down in between there, you'll be able to see the medial head down in there. You can see it's much smaller. Let me grab my probe here. So I'll try to pull this open as far as I can without getting my fingers in the way. And you can see that medial head right there. Try and pull that open. There you have a better view of that medial head. And you should be able to see that from the medial aspect as well. But here you can see all 3 triceps together. My thumb holding back the lateral head, that smaller medial head inside, and then the long head there. Now also here on this lateral side, you may be able to see the brachialis if you have your clavodeltoid cut enough. You can peel that back and you'll be able to see this muscle right here, that if you look at it closely enough, you can see the muscle fibers are running this direction. That is the brachialis muscle versus the clavo or acromiodeltoid right here. This would be the brachialis with those fibers running this direction. Now you're going to have to go to the medial side to see the epitrochlearis and the biceps brachii. So the epitrochlearis is the muscle that's connected on the medial side here. And you're going to have to actually cut around it and peel it back to be able to see the bicep brachii underneath it. So my finger right here is rubbing against the bicep brachii. Think of it kind of like your cat's making a little flex muscle there for the bicep brachii. Now I'm going to try to show you how I would dissect the epitrochlearis on this side, if I can get everything to be more stable here. Not sure if I can or not. This side is undissected. You can see that epitrochlearis on the surface here. You're going to have to cut around that to peel it back up to see the bicep brachii underneath it. So just to go over those muscles again, on the lateral side here you can see your triceps. The ones on the surface are the lateral head, which is the most laterally located, your long head of the tricep brachii, which is the bat wing or the bingo granny flap. When you open them up, down in between them, you'll see that much skinnier medial head in there. Sometimes you can move your clavodeltoid over enough to see that brachialis muscle. And then on the medial side, that surface muscle there is the epitrochlearis. Remember, epi means upon, and trochlea is the part of the bone that makes the elbow. So upon the elbow, peel that epitrochlearis back, and you'll be able to see the bicep brachii underneath that. And you'll also be able to see the triceps from the other side as well. Like that's the long head here, that granny flap. And you can see that bicep brachii there.